Assalamualaikum, good morning. My name is Siti Khadijah binti Muhammad Faiz. I am student interior architecture semester 3 in UiTM Puncak Alam, and I'm here today to talk to you about post-traumatic stress disorder and how does this PTSD happen to ourselves or others. It might help to you to think about what is PTSD. So to begin with, what is PTSD? Mental health condition that describe a person who has experienced extreme trauma in the past and is unable to move on with their life. Therefore, PTSD is also include side effect that a person mostly it can happen regardless of age and gender. For example, we will feel scared and be prone to panic attacks. So did you know that the symptom of PTSD, this strong symptom of anxiety often lead people with PTSD to begin. To begin with, the intrusives such as a repetitive, unwanted memory, flashback, and nightmare, which is a severe emotional distress or physical reaction to something that reminds to you of the traumatic event. In addition, avoidance, which is a resisting conversation about the event. Other common symptoms of heightened arousal such as is the trouble falling asleep, and the last of category of symptom is change in the thought and feeling, which is loss of interest in one's enjoyed activity. So the next I would like to explain the common event that can lead PTSD include is war, natural disaster, car and plane crashes, kidnapping, rape, physical abuse, sexual abuse, sudden death of the loved one. Well, let's do the heart. What factor for PTSD include when someone had a history depression, anxiety and another mental illness, previous traumatic experience, especially in early life. Maybe it can happen when your family history of PTSD or depression. Mostly the PTSD more women are at risk than male. Such as while the overall past year prevalence of the PTSD in adult estimate at 3.6%, the number indicate that PTSD is far more common in the women than in men. The past year prevalence of PTSD in men is estimated at 1.8%, while PTSD symptoms affected 5.2% of adult women. Men have been found to experience more traumatic events during their lifetime than women. But PTSD symptoms in men are far less common than symptoms in women, or high level of stress in everyday life and lack of support after the trauma. Fortunately, there are many healthy coping skills for PTSD that can help ease anxiety and other symptoms. This strategy may help reduce the intensity of anxiety, lessen its frequency, and or make it more tolerable. Firstly, deep breathing. So breathing play an important role in the stress response. Unfortunately, many people do not breathe properly. This causes short and shallow breath, which can increase stress and anxiety. Fortunately, it's possible to relearn how to breathe deeply from your diaphragm and help protect yourself more stress. Furthermore, is progressive muscle relaxation. Using relaxation experience can also be effective coping skill for PTSD that provide a way to reduce your stress and anxiety. Progressive muscle relaxation focus on alternating between tension and relaxation different body. In addition, mindfulness techniques are useful grouping skill for PTSD. Mindfulness has been around for thousands of years, and mental health professionals are beginning to recognize that mindfulness can benefit people dealing with anxiety, depression, and other mental health condition. Is it important to note that this type of self-reflection can sometimes bring difficult emotion or thought to light. So So we can go to the bar graph for PTSD. This is the risk of the develop post-traumatic stress disorder depend on how traumatic the event is of the different traumatic event. RAP has the highest PTSD prevalence at 49% compared to natural disaster at 3.8%. PTSD after RAP statistics also show that 94% of women who were raped developed PTSD symptoms during the first 2 weeks after the traumatic events. 30% of the them still experience PTSD symptoms 9 months after the incident. This is a chart for PTSD prevalence of depression among university students from different countries in 2013. University students face many challenges include independent living, academic stress, as well as planning for their future career, and this predispose them to depression. These are emotional and mental stresses can influence the to high-risk behaviors such as the increased level of smoking, increased alcohol consumption, increased self-injury, and behavior. Furthermore, depression can also affect their physical and mental health. Various risk factors for depression among university students have been identified, such as higher student year, lower socioeconomic status, poor academic performance and life satisfaction, high level of alcohol consumption, smoking, gambling, social support, life stresses, post-traumatic stress disorder, physical inactivity, overweight and obesity, and sleeping problem. University students are many special group of people in the critical transition from adolescence to adulthood, and one of the most stressful moments in the person's life. University students have a potential influence on the family and they contribute to the country workforce in their future in the given country. Because of their potential role in society as well as in the country, is it significant to study on their depression problem. Therefore, the purpose of the study is to determine the prevalence of depression and its causation with social demographic, social and health variable among university student Malaysia. In conclusion, we already know that most people in Malaysia suffer from the post-traumatic stress disorder PTSD, regardless of the age or gender. In addition, there are several reasons why a person experiences stress, including financial problem, argument, fight between parents in front of their children, as well as flashback about abuse, which will also harm a person's condition if not treated properly. So this is on every June is National PTSD Awareness Monthly. So this is all from me. So thank you.